Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. It is Friday the 13th, November 13th, and it has been a Friday the 13th. So this is your chance to ask questions, and we'll get them. Please put them either at our Facebook questions at Douglas Public Health Network, or you can put them in the chat section. So we'll see how this goes. I'm literally running and a little out of breath here because it has been quite the day. We had 30 new cases today, and they were coming in fast and furious. So if you have questions, put them in the chat section. We'll get to you. In the world, 53 million cases, 1.3 million deaths. Yesterday, there were 650,000 cases in a single day, an all-time record, and there were 10,000 deaths in the world. Again, really very active in the U.S., India, and Brazil. We're also seeing still a lot of activity in Central Europe, in Germany, in France, and Spain, and Italy, and the UK. Pretty quiet in Norway and Finland still, but in the rest of Europe, still very, very active. Israel we had looked at, because you remember in Israel in the beginning of September, they had this really steep spike, and they did a 4-week lockdown, and with a 4-week lockdown, they're already down already. So 4 weeks of lockdown seems to be a positive approach even in this time. In the U.S., we're 10.9 million cases, 250,000 deaths this weekend. There are 40 states with over 1,000 cases yesterday. I mean, that is stunning. I mean, there are so many small states that only have a few 100,000 people to have 40 states with over 1,000 cases each, including, sadly, Oregon yesterday and today. The number of deaths is now starting to go up again, not surprisingly. Deaths typically follow 2 or 3 weeks after the spike in cases, and now we're averaging over 1,000 deaths a day. 161,000 cases yesterday, just a stunning number. In Oregon, we're at 53,000 cases, 746 deaths. We had 1,100 cases yesterday, but almost 1,100 cases today. Death looks like it's starting to go up. That weekly death count last week in Oregon was the highest it's been in a while, so that's a problem. But really, the issues in Oregon has been hospitalizations. So the big hospitals in Portland that do most of the intensive care. So when we have sick people, some of them get treated in Douglas County, but many of them need to go up to Eugene or Portland to get cared for. And that's why you worry about the hospital capacity in Portland, because if they run out of capacity, then when people get really sick here in Douglas County, there'll be no place for them to go. Hospitalizations are really at an all-time high in Oregon, and so we do worry about that. There was a governor's press conference today at noon. Basically, we're going to do at least a 2-week freeze, with really a cutback and lots of different things to hopefully reduce the rate of disease. I think that's very reasonable at this point. I mean, looking at the way that the cases are increasing, and especially looking at the narrowed hospital capacity in Portland, this is a worrisome time. You know, if this would double again in the last week, and it's about doubled in this last week, if it would double again, we would really be in tight places. In Douglas County, 589 cases and 10 deaths. We have 125 just over the past week. I mean, that really is a lot when you consider it took us months to get the first 125, to get 125 over the last week, and there were 14 people in the hospital. So I graphed out today the rate of hospitalizations. You know, and for the last many months, we've been 2, 3, 4, 5, 6. Have 14 in the hospital today is really a worrisome problem. In Douglas County, there's lots of outbreaks. The biggest one is an outbreak following a Halloween party in Reedsport. So this Halloween party in Roseburg has at least 15 cases associated with it, and it's impacted the school, the harbor, the clinic, and so we really do have to worry about these gatherings along the way. Okay, so let's go through some questions here. We're going to think, other than being highly contagious, aren't the symptoms not even as bad as having a common cold? Christy asked. Absolutely, positively not true. So for the variation in this disease is enormous. There's probably 20% of the people who have no symptoms at all. Obviously, that's less bad than a common cold. About another 20 or 30% have very mild symptoms like a common cold. But unlike a common cold, 20% of the people have this wind up in the hospital. Less than 1 in 10,000 people wind up in the hospital with a cold. 20 in 100 wind up in the hospital with this. Nobody dies from a common cold. Still 1 or 2% of the people who are diagnosed with this have a common cold. So I don't know where in the world anybody would suggest it's not as bad as a common cold. That is just totally, totally wrong. So if I misread your question, please let me know. So Crystal asked, do our schools have to go to distance learning? And this did not change any of the school things, but with the number of cases we've had, the schools may need to go to distance learning anyway. So Amanda says, how common is it locally that our COVID cases were following safety protocols and still catch it? We can't find one. So, we have not found anybody yet who followed all the rules and still got it. Almost everybody that gets it has a break in the rules. So I investigated 3 cases today. One was they went with a friend to a party in Corvallis. The friend got it, and then this person got it. The other one was somebody who was working in Montana with somebody who was positive. They weren't wearing masks at the time, and they got it. And then the third person was somebody from this party. They go to this party, no face masks at a big party, lots of people indoors, and they got it. So we don't know where every single one of our cases go, but when we look at our cases, we've yet to see somebody who really followed all the rules and still got it. And so if you follow the rules, your chances of getting it are very, 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 very much lower than going to the party in Corvallis, working at a place where other people are positive. Are most of our cases related to group events? Yeah, most of our cases are related to some break in protocol. Now, these are not necessarily truly egregious. The one I investigated yesterday was a family. A woman got it from her husband. Now, obviously, it's not the woman's fault that she got it from her husband. They're living together. But her husband was there as part of a hunting party. And during the hunting party, people didn't wear masks. And one person in the hunting party was positive, and everybody else became positive. So Bruce says the news review article said going to the grocery store was the top 10 cause. Well, I think it's going out in public without a mask. So grocery stores and big stores like Lowe's and Home Depot and places like that are not considered to be big spreaders if you wear a mask and maintain distance. But if you go to the grocery store and hang out with friends, go to the grocery store and get close to people who don't wear a mask, then it could be a problem. Shelby says, do you see elective surgeries being limited or canceled in the near future? Well, it's already starting to happen in Portland. And it's starting to happen in Portland because they're running out of just staff capacity. Right? So elective surgeries require nurses and anesthesiologists and whatever to do it. And they're getting short on staff and a little short on protective equipment. And that's why they're canceling some elective surgeries. I don't see that happening here yet in Douglas County, but it depends on what happens to the hospital capacity. At 5 or 6, like we've had for months, didn't really impact Mercy very much. When we start to get to 14, it will, because there's a 16 bed ICU, really a beautiful ICU at Mercy, but only 16 beds. And so now if it goes from 14 to 28 next week and half of them need intensive care, that is going to really put a problem. So that's why we really need to stop this now. So Casey says, what are the risks of making food and sharing it with others for Thanksgiving? Almost zero. So we don't think that this is transmitted orally. So we don't think there's really any risk of that. So Beverly says, why don't we require that employees test negative twice before returning to work like other places do? Well, Beverly, those other places are wrong. And I know there's some places in town. You could tell me the places that do that. That would be it. That is not a source of illness. If people truly wait 10 days after their positive test and are not hospitalized, there are no cases of transmission after the 10 days. So a negative test is a waste of the test. Plus, there's some people who will continue to test. They will continue to test positive for weeks or months, even after they are no longer contagious and no longer sick. And that for them is really an impediment to going back to work when they're otherwise well. So we do not test negative twice before returning to work like other places do, because the other places are wrong. And Beverly, if you can tell me what those places are, I will call them, inform them of the more recent guidelines. So Kat says, can you confirm that 17 are in the hospital? Yes, I think there was 14 was the last number, but this numbers are changing every few minutes. Vanessa says, confirmed 30 minutes ago that there were 14 at Mercy that were in the at there. I know that there's 14 at Mercy. I know there's one at Riverbend, at least one, maybe two at Lower Umpqua Hospital. So, there's a lot. So 14 at Mercy, 2 at Lower Umpqua, one at the VA. So yeah, so actually it's 18 because there's one at Riverbend. So a lot of people in the hospital. Remember, during this entire time, even during the beginning, we were only having 4, 5, 6 in the hospital. 18 in the hospital is a lot. 9 in the ICU and the PCU is a lot. So as I said, there's 16 beds in the ICU. So it's really quite worrisome. Well, there is some good news this week. One of the good news in this is that one of the really good news in this is that the vaccine data looks like it's good. It looks like that the Pfizer vaccine, which Pfizer BioNTech vaccine, which is a messenger RNA vaccine, looks to be at least 90% effective. So that's a good thing. Now, obviously, they'll get more data, and that could go up a little bit or down a little bit, but shouldn't change that much. So that's the good news. So Beverly says, am I saying the illness stops in 10 days? Absolutely not. So what happens is from the first day of illness, you can have symptoms. The symptoms are usually worse. The symptoms start off kind of mild. The symptoms then get worse, so that most people get hospitalized on the 7th or 8th day of illness. The most treacherous time is the 13th day after illness. What I was saying is, in terms of being contagious, you're most contagious actually a day or two before your symptoms start, and then the first 3 to 5 days of symptoms. If you're not hospitalized and ventilated, after 10 days, we do not think you're any longer contagious. In fact, when you try and find viable virus, that's virus that could infect somebody else, it's really hard to find after the 7th or 8th day. Now, what we do know is that people go on with symptoms for months and months and months, and we have our long haulers who were sick back in March and April who sometimes still have symptoms that long out. So and then the other thing with testing is, with the PCR tests, you typically start with the PCR test positive 3 or 4 days after exposure, and that can go out for weeks or months. So there's 3 different things. One is symptoms. Symptoms can go on for a very long time. The second is a positive PCR test. That can go on for a long time. But the third is infectivity. Can I infect somebody else? 10 days after the onset, we think you can't. Now, the exception is if you're in the ICU and have tubes and whatever, and we think in that case you can infect up to 20 days. So how do you know when you have a positive case in school and don't test the others in class that there aren't asymptomatic children in class taking it home to their families? So that's a big question. Could there be one kid in class and the other people asymptomatic? So what Oregon has done is tested everybody in the class in cases where there's more than one case. What they found is that there are not a lot of other asymptomatic people in class. So at least the little bit of data that Oregon has collected suggested that doesn't seem to be a problem. And we've had now over a dozen school outbreaks, and we've not had that situation where somebody is tested positive, we go back and then find that it was a kid in the class. And we would find that because, for example, if somebody turns positive, you say, well, tell me the names of all your kids and whatever. And if Johnny Jones is my kid, and then Johnny Jones was also in a class that had it, that would alert. And we've not had any of those. So while theoretically it's possible, it does not seem to be the case. Now, if there are asymptomatic kids in the class, we are offering testing to all of those kids. So if kids want to get, if asymptomatic people want to get tested, we can do asymptomatic testing. Most people do not take us up on it. So We're not big into asymptomatic testing of big populations, but testing of asymptomatic contacts is something that we would encourage. All right, a couple of other things. Nature came out with a study this week, and they looked at people's movements by tracking their phones, and they looked to see the people who were positive where they tended to be. And it turns out that restaurants, gyms, and cafes are tremendously overrepresented in the people who are sick. That confirms the CDC study, which did a case control study of people who had COVID and people who had other things besides COVID, and they asked them what they did, and what they found is that people who had COVID were much more likely to visit restaurants and much more likely to visit places where people weren't consistently wearing masks, and this would go along with it too. So Sandy says, can you have the virus without a fever and have just the other symptoms? Absolutely. This is a weird little virus here. I mean, unlike influenza, where almost everybody's got fever, there are a lot of people with this who have no fever at all. Other people have fever for weeks. So there's a big variation. About 80% of the people, 80 to 90% of the people who have this have fever or feeling of fever at some time during the illness, but rarely do they have it early on. And so you see places where they check people's temperatures and whatever. It's turned out that is a terribly awful strategy. So they TSA looked at all those people they screened when they came back in the country. It turned out that temperature screening, which is what they used, was nearly useless. It found less than 1 in 80,000 cases. So, pretty useless screen of looking for temperature early on. Now, when people get the disease, we ask them to follow their temperature to see if they have fever. But early on, in the time when you're really contagious in the first day or two, fever is not all that common. So what's the procedure of a business like a store has 6 cases? Do they test employees? And how long does that take? Do they close? Tabitha asks. So let's say there's a business and there's 6 cases in a business. What we would do is we would interview those 6 people and see who they all had contact with. Because businesses are like businesses, it depends on what the business is, right? So the business is Mercy, or a huge factory with 50,000 people working in the factory, 6 cases may not mean very much, but when you interview them and they all work in the same shop or they all work in the same unit, then that obviously makes a difference. So what we would do in a case where there was 6 cases, we would interview and see who those contacts were. We would quarantine those contacts, and we would recommend that those contacts get tested, certainly if they're symptomatic, and recommend that they get tested even if they are asymptomatic. The question is, does the business close? The business may or may not need to close depending upon how big it is, right? If it's a store with 400 employees and they have 6 positives, probably not. Unfortunately, what we've seen is that, many of the businesses in Douglas County are small. They only have 6 or 8 employees. And if 6 employees are out, your business is pretty much toast. And so sometimes they do close. So Leanne says, has the guidance changed about masks outside with others? No. I think if you're within 6 feet of people outdoors, you should wear masks. If you're more than 6 feet away outdoors, you can take your mask down. Since temperature screening is nearly useless, do you see any chance in having them stop doing it in public schools? Well, there's no recommendation that schools do it. There are some schools who choose to do it, and we don't ever stop people from doing it, but it does not seem to be very effective. And actually, Oregon Health Authority does not recommend temperature screening in schools, just because it's not a particularly effective way to do it. And what we found was there were some people who said, well, I don't have a fever, so I must not have it. And that is totally wrong, right? Again, because many of the people who are the most contagious don't have fever when they're contagious, and people are saying, well, I don't have a fever, I must not have it. That's really wrong. So schools are not recommended to do temperature screening. If they do it, maybe at their own choice, but we're not recommending it. So Kat says, if long haulers can have symptoms long-term without being contagious, are patients in the hospital not contagious after 10 days too? So the story is that we think that in the hospital, if you're in the hospital and have a deep lung infection, which almost everybody in the hospital does have, they can be contagious up to 20 days. And the question is then, could they be off precautions, and do they have to die alone? So it turns out that the reason that hospitals don't allow people in the ICU is not so much that they won't get it from their loved one, but there's so many other people around there that it's just really, really, really hard for some hospitals to allow family to be around people who are sick with COVID. And that is perhaps one of the most heartbreaking parts of this disease. So I've been long involved with, people talking about improving end-of-life care. And end-of-life care in the United States has been sort of all over the place. A lot of people die in ICUs. A lot of people would prefer to die at home. A lot of people have much more done at the end of life than they would really want. But because people don't know how to necessarily ask for it and say, won't you stop, a lot of people wind up with more care than they want. If you look at people who know a lot about this, doctors and lawyers and whatever, they typically don't die hooked up in the ICU. They typically die at home surrounded by loved ones. And so we know that people, for the most part, none of us want to die, but if we did die, we would want to die at home in a comfortable surrounding, surrounded by loved ones. And one of the most heartbreaking parts about this is many of the people who die of COVID don't have that kind of death. So many of the people who die with COVID get diagnosed with COVID, they go to the ICU, they're kind of all alone except for the staff, and they don't get to see and be with family and friends. Now, Douglas County is a little bit better than others. Is a little bit better than others because the visitation policy at Mercy has been a bit more liberal than in other places. There are other places where you can't visit anybody in the hospital. So, your wife's having a baby, husband breaks a leg, there's no visiting at all. But actually, for me, that's one of the most sad parts when you hear people on TV talking about they lost their dad or they lost their husband and they didn't get to see them for the last 3, 4, 5 weeks of their life. So Lane says, if you're asked to quarantine and get a test, how much do they cost if you have no insurance? The good news is there should be no cost to you. So if you're in quarantine and get a test, the best test to get is the PCR test, like the one we do in the drive-thru. Nobody has received a bill for that. And in fact, if anybody has, I want to know, because we were promised early on that anybody we send through that clinic will not get a bill for the test. So the answer is, even if you have no insurance, nothing. Should cost you nothing. Now, obviously, these tests aren't free, right? So there's labor. Somebody has to fly it to the place where they're doing it. Somebody has to run the computer to report it. There are chemicals and reagents. They cost something. It probably costs about $40 to do a PCR test. About $40 to do a PCR test. But Quest had to deal with the government that the government is going to go ahead and pay them for the test that they do. So you should not get a bill whether or not you have insurance. So Diana says, I heard that Oregon and Douglas County is going into lockdown on Monday. Is that true? Not exactly. It's not a lockdown. It's called a freeze. And the governor talked about it today at noon. And it basically was, we're going to freeze some activities. And basically, we looked at the activities that contribute most to outbreaks and those that contribute least. And it's a sort of a funny group. So, you think that going to the hairdresser would be high on the list. It turns out not to be. In fact, we can't find really any cases where both the client and the worker were wearing masks in a properly ventilated place where there's been any transmission. And so those are not restricted. We have learned that daycare centers don't seem to be a high place for transmission. So daycare centers are not particularly affected by this new thing. But what we found, consistent with that Nature article, consistent with others, is that bars and restaurants very clearly do appear to be places where there's lots of spread. Clubs, like the Halloween party that we're talking about here, clearly seem to be a place of spread. And so that there's going to be a change in indoor dining. I think it's starting on Wednesday. So we will see. Gyms, there's an association of these outbreaks with gyms. both anecdotal things where people have had outbreaks in gyms and this Nature article which showed that gyms did appear to be a source of spread. Being somewhat of a gym rat in the past myself, that's not surprising at all. I mean, you spend a lot of time around others, close to others, breathing heavy. And so gyms are affected. So Angelica says, how close are we to the 200 per 100,000 threshold for schools to be shut down? Pretty close. So our cases started to come up just 2 weeks ago. So our cases were in the sort of less than 10 range until last Thursday. And then last Thursday and last Friday was just crazy. And then this whole week has been crazy. So we have 125 cases over the past week. I mean, I can't predict what's going to be till Saturday, but we had 30 cases today. And as I was leaving the office, they were getting 2 or 3 at a time. So I think it's pretty likely we're going to be close or above that 200 per 100,000 in the schools. Now, it's very complicated because our schools in Douglas County opened up under previous exceptions. So I can't begin to interpret what that means. I think some schools are going to voluntarily close, and I think other schools are going to probably reevaluate what they're going to do. All right. Yeah. So Jasmine says, what about workplaces that are too small to socially distance? Is the responsibility of the management employer to install safeguards? What if they don't? Yeah. So one of the things I think is great are these food trucks, but when you see these food trucks, which are very small, it's hard to think about how you could adequately socially distance. I think we should do everything we can do to do it. So the one food truck that I go to a lot, it's family in the truck. And so family is considered to be family. So being around each other, it's not a big deal, but I think it's going to be hard. Safeguards are going to be really, really hard in some businesses. So it's going to be a problem. So in doing the responsibility of businesses is being managed by OSHA, Occupational Safety and Health Administration. And so if you have a concern about that, you can call OSHA and they can tell you about that. So Penny says it costs to get the doctor order to get a test, correct? Not correct. That is not correct. For example, you can go to Rite Aid. There's no charge there. If you call the Aviva Sutherland Clinic and do it, there's no charge there. So there should not be a charge to get a test. Now, if you say, I'm sick with all of these symptoms, and you go to the doctor and have a doctor's visit, and as one of the things they do, they order the COVID test, you may still get a bill for the rest of it. If they do a blood count or something, you'll get a charge for the rest of it, but you shouldn't get a charge for the COVID test. So what is the test positivity right now here? I can't tell you where it is right now here. And it was 9.2% last week. It's likely to be higher this week because we have more tests. So what happens is we get the positive test right away. The negative tests trickle in days later. And so, for example, I looked at a bunch of cases today, and a bunch of other people in the family got tests. They all had negative tests. They weren't yet in the system. So I don't know what the number of negative tests is, so the positivity rate is a little hard to tell. It probably is like the rest of the state, which is a little over 10% at this point. Again, if you want to get the test, you want to get the PCR test, you can get it. The Aviva number in Sutherland is 541-459-3788. So that's 541-459-3788. Andy says, does the gym closure impact physical therapy offices? The governor specifically addressed that today, and she said that it wouldn't. I have not seen the official order, so I don't know. So I would have you look at the official order. But what she had said was that what they found is that physical therapy offices, chiropractic offices, and massage places have not been the source of much spread. And so I believe they were not part of the closure. But I had 6 things to do since the governor's thing, so I haven't read through all of that, but I would have you read through those specifically. Okay, a couple of other things along the way here. The mink situation is just fascinating. So mink, little weasel-like animals that we breed for their fur, maybe we'll stop doing that, do seem to actually be able to get the disease from humans and actually then do seem to pass it back to humans. And so there's been some concern about that, but it does spread very quickly in mink and can spread back to humans. So that's a concern, and it's a concern that there then could be an animal reservoir for this virus. Now, mink wouldn't be a big deal. There are not a lot of mink around, but if it's cats, it doesn't appear to be cats, house cats yet. But if it was cats or possums or squirrels, there's a lot of those around, and that could be a really problem because it could have a reservoir of illness. So what's your opinion on one household being around another when both groups follow the guidelines of masks? Gabrielle asks, well, obviously safer than if you didn't wear a mask. Anytime you increase the number of people you're around, it increases that. Now, most times when households get together, they don't get together just to talk with masks on. They get together to eat or drink or party or whatever, and they typically take their masks down. And that's what the problem is. So the problem is, we don't see very much spread when everybody's wearing a mask. Where we do see this spread is where people take down their masks. So, for example, in workplaces, we don't usually see it during the workday. So it's not the people I actually am in the workplace with. It's the people I'm in the break room with and the people I go out for a drink with after the bar. So it seems to be when people are really wearing their PPE, we don't have very many cases. It seems to be when they naturally take it down because they're having a break, and that seems to be the problem. So Wendy says, give us the number of people who have recovered. So again, the definition of recovery has been difficult because it has changed many times along the way. But what we would say is that if you take the number of people in isolation, those are the active cases. So you take the total number minus the number that are in isolation, and you get a number of what the recovered are. And I'll ask Vanessa to put those numbers up as of today, and I'll get you what the number is. So Veronica says, are you and your staff tired? Yeah, a little bit. But if you're not tired during this pandemic, you're probably not working hard enough. It's been a long time since I've had a day off, and we're working many, many hours. I will tell you, 8:30 Sunday night, I was calling people about new cases. So yeah, we're working long hours. But one of the things we do every single day is we check to be sure that staff is doing okay. If people need to take time off, if people need to get a break, we're having them do it. This is not going to be over on November 15th or December 1st. This is going to continue to be really a wretched winter. And I think until next spring, when we start to get some vaccine, when we start to get more of this monoclonal out, when we start to get this monoclonal antibody out, when we start to get just better weather in the springtime where people can go outside, I think this is going to be a long time. So Vanessa tells me that we had 152 in isolation this morning. That is a lot of people in isolation. 589 cases. So doing the math in my head, that looks like 432 who have recovered by the definition that they're no longer in isolation. Now again, when we talk to people who have the disease for weeks and months, many are still not better. So a friend of mine has a sister who'd had this, and she lost her sense of smell and taste months ago, and it's just starting to get it back. That everything tasted like cardboard, and now they're just getting their sense of smell and taste back. So by the out of isolation, you might say they were recovered, but I don't think this person who couldn't smell or taste, or the person who says, I used to run miles and miles, and now I can barely walk down the hall with a gathering short of breath. I don't think we would consider them to be fully recovered, but they would be no longer contagious. A couple other things along the way is that these rapid tests, these Binax tests, are now widely available. I think at least half of our positive cases, maybe more, in the last few days have come from the positive tests. So the other tests, the PCR tests, are very accurate. They're very slow. They're best done for asymptomatic people where you're not looking for the result today or tomorrow. The rapid tests are great for symptomatic people. The symptomatic people, because you can get the results back in 10 or 15 minutes. And when you get the results back in 10 or 15 minutes, you can both get people the results, and then you can find out who all their contacts were. And so they've been great. Some of the increased cases in the last week is because we're doing a lot more rapid testing. We think some of the cases we found this week, had we been doing the other things, they would have trickled in over the weekend and early next week. But we know about these cases now because we're doing the rapid testing. And so that could account for a little bit of the spike, but clearly not all of it. Again, most of this spike is related to several big parties that we know of. And they were Halloween parties. There was a party at a poker place, or parties at bars. Those are the places where we've seen the spread. There's been a little bit of spread among church groups, a little bit of spread among hobby groups like card groups and others. So you really, 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 really need to be careful. Again, the goal should be that in any week period you have very few contacts. And so I try really, really, really hard not to have more than just a few contacts in a week. Now, you could obviously get a lot, right? I can go to lunch with a few people, dinner with a few people, have big meetings and whatever, where I have 20 or 30 contacts in a week. I try really, 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 really hard to have just a handful. So Diana says, when's the next Q&A? Well, if it's this thing, it's been twice a week since March, and we do them on Tuesdays at 6 and then Fridays at 4. If you think of a question in between them, if you send us the question at Facebook questions at DouglasPublicHealthNetwork.org. So Facebook questions at DouglasPublicHealthNetwork.org. We'll get them the next time. So somebody says, why are the homeless not dying or getting sick from COVID? What's very interesting is that there are two groups of homeless. So homeless who are living in shelters have this at an incredible rate. So all over the country, there have been outbreaks in homeless shelters. So where people are living together in congregate facilities, and it's been horrible. Many of the homeless in Douglas County live outdoors. Being outdoors, much lower risk. They tend not to socialize indoors. And again, socializing indoors seems to be the biggest risk factor. And since they tend to live outdoors and not socialize indoors, they're having a low rate. We've had a few homeless individuals in Douglas County have it. We put them up in hotels and whatever. But in general, the people who are living outdoors have gotten this less. It's again, being indoors with other people. So Stephanie says, how accurate is the rapid testing? So the rapid testing is pretty accurate. So there are 4 basic kinds of tests. So the first test they came out with was the PCR test, which is a polymerase chain reaction. And what that looked at was the test that the CDC did. It's a very complicated test. It looks for 3 separate RNA sections of the virus. So what I tell people, imagine if you've got your encyclopedia here, it looks for the exact wording of 3 pages. And so it amazingly can find whether the virus that you're testing matches the 3 pages it knows about, and it has to match exactly. So you have to have 3 exact matches. So those tests are very specific. You're rarely going to find one that's incorrect because they have to match so carefully. They're very complicated to do. They're very, very complicated to do. They're very labor intensive, and they're slow. And so that's the PCR testing. At this point, we're recommending PCR testing for asymptomatic contacts because you want to really know if you're asymptomatic, so you don't know if you don't have symptoms by definition, and you really want to know if you're positive or negative. And since you're an asymptomatic contact, you should be in quarantine anyway. And so if it takes a day or 2 or 3 or 4 to get the result, that's okay. So that's what we're recommending for the PCR test. They're also recommending the PCR test before travel, if you're going to go to Hawaii, and usually before you're going to get an operation, because again, they really don't want to have a lot of false positives and false negatives. The second are the PCR tests that are the quicker ones, and that's the BioFire or the Abbott ID Now. Those are less sensitive and less specific, but quicker. So they are pretty good. They're about 90% as good as the PCRs in terms of sensitivity, about 90% as good in terms of specificity. So they're pretty good, but not as good. And then you get the antigen tests, which are very easy, very inexpensive. I mean, less than $5 for the Binax. And those appear to be not quite as good as the Abbott ID Now and not quite as good as the PCR, but still pretty good. So what we're recommending is that those rapid antigen tests be used for people who are symptomatic and not critically ill. So that's most people, right? It's about 80% of people who have the disease are symptomatic and not critically ill. And so those would be the ideal people to do it. In those days, they've been pretty accurate. I was on a long call today, and we talked about that. The rapid antigen tests are probably not accurate enough to do huge populations. So they could have like as many as 3, 4, or 5% false positives. Now, if you take somebody who's already symptomatic, 3 or 4 or 5% false positives is not terrible because you're symptomatic, and so that's okay. But if you're going to do sort of a big crowd, let's say take everybody who was going to the Ducks, you say, well, we're going to test everybody before the Ducks game. Well, if you tested 50,000 people before the Ducks game, and even 1% were false positive, you have 500 people, you say, well, I think you got COVID. That would be impossible to manage. I mean, what would you do? Would you quarantine them right away? Would you start doing contact tracing? What in the world would you do? So they're not accurate enough to do the big screening, but they're really good for symptomatic people, and we are encouraging all of our clinics in town, if somebody's symptomatic, to do the Binax test. So Florence says, when do we think we will know if Roseburg schools will close? So the school metric data is based on what's called the Morbidity and Mortality Week, and that starts Sunday morning at 12:01 and goes to midnight on Saturday. Again, remember the week, until the 5th, we didn't have very many cases, so they're going to look back 2 weeks. And when they look back 2 weeks, it's going to be 2 of the worst weeks. So I don't know what the numbers are. I was trying to predict today what it's going to be. I think it's going to be right at the 200. And if it's right at the 200, then we'll know a little bit better with that. If it's between 100 and 200 per 100,000, the schools have another week to transition. If it's over 200,000, we think they should close. But again, it's complicated because there are exceptions, and I'm not sure how that's going to play out. So how many children in Douglas County have gotten COVID? It's more than 10 and less than 100, but Vanessa can find the exact number. It's more than 10 less than 100. Have we had more than just the one child from UCrest? So at UCrest, there's a couple of things happening. There's some teachers that are positive, and then a kid in the class is positive, but you don't think the kid in the class got it from the teacher or gave it to the teacher, since everybody got kind of sick at the same time. So it's a little hard to know what's happening there. So Nancy says, could you please review the long-term effects of COVID? Well, we don't know about the long-term effects because remember, this disease is just out there for less than a year. And so we don't know about the long-term effects, but we'll talk about the effects that are at least 6-month effects. So starting from the top down, there are clearly some neurologic impairment in people who have had this. People describe it as brain fog, and there's clearly a decline for some people in their test scores. So if you measure, like the test scores we do for concussion, they don't do as well as they would do otherwise. There are people who've had strokes and other kinds of vascular things in the brain that they continue to struggle with. In terms of loss of smell and taste, there are a lot of people who are complaining that their taste and smell hasn't come back all the way, although the majority do. So the majority do have it come back. And for many people, it's like, oh my goodness, I could taste it again. And so we had one fellow who we were delivering food to, And about a week into this, it was like, yeah, I could finally taste my Chinese food. And so it was really a great day for him. So most people get it back, but there are some people who do seem to have long-term loss of smell and taste. We get to the heart. There are clearly some people who have long-term heart problems. We're worried about the myocarditis, and this has been a weird one because there are a bunch of studies out there that are a bit contradictory. So they did autopsies on people who had COVID, and they did not find a lot of myocarditis. On the other hand, when you do MRIs of people who had even mild illness, the MRIs look like there's myocarditis of the heart. So the myocarditis thing is still out there. Myocarditis is really important because myocarditis, which is an inflammation of the heart muscle, doesn't get better very well. So when you get myocarditis, it seems to injure the heart muscle. And the concern will be that if young people in their teens and 20s get this and have a 20% weakening of their heart muscle, they're not going to notice it in their teens and 20s, but you will start to notice it when they start to get in their 40s and 50s. And so the worry is that there will be a long-term concern there. The lungs are probably the area that has the most concern. These lungs look terrible on CT scan and X-ray. I mean, they just look awful, and the function is poor, and we don't know how well they're going to repair. Now, the lungs do a pretty good job of repairing some things, not a very good job of repairing other things, so we do not know what the repair is going to be. The other long-term effects have been in the kidneys. This disease does cause a lot of vascular problems, and there are a number of people who have had COVID and have gone into chronic renal failure. Some have gotten their kidney function back, but many have not, and many of these people will either be on long-term dialysis or require a transplant. So those are the big areas. They're always reporting new things each day, but those are the big ones. The heart, the sense of smell and taste, the brain fog that people are getting, the lung thing, and the kidney stuff. So going back, I was right. It's more than 10, less than 100. So 35 kids under 15 in the county with COVID. And we report that we'll do the exact report next week. So Lee says, when do you think we'll have the ability to do frequent home testing? So anybody who's been watching for a while, you know what I want for Christmas this year is frequent home testing. And I talked with somebody about that today. We thought we were close for a while, but it doesn't. It was a little disappointing. So the way this would work is that, again, ideally, each week everybody in the country would get a little package that had 7 shot glasses in it, and you would each morning spit in the shot glass. And if the shot glass was negative, you'd say, I'm good to go, and then you'd go to work. If the shot glass was positive, you'd stay home, and then you could do one of the more accurate PCR tests. And if the PCR test was negative, then you'd be good to go. If the PCR test was positive, then you would be a case and you would need to stay home. If you did that, you really, really, really could make this better. To do this, you'd have to have both the spit tests, which they've been talking about since April. Like next week, we'll have these spit tests out. And they have just been super duper slow in getting there, right? I mean, March and April is more than 6 months ago. And so there must be something going on with that. And so I don't know about that. And the second thing you would have would be the ability to get rapid, very accurate PCR testing. Because if you said you spit in the glass and it's positive, and then you have to go somewhere and maybe you'll get the test results back in a week, that's not going to work. You have to be able to get the results back in 24 hours. So a lot of people says, I refuse to live in fear of COVID. Is there a tactful answer? Alan says. So fear is a human emotion. And, I don't live in fear of COVID. So I don't understand what the refuse to live in fear of COVID. I mean, I understand the risks, and I take precautions to avoid those risks. I mean, I don't live in fear of driving. Clearly, there's a lot of risks in driving, but I drive a safe car. I don't drive over the speed limit. I never drive drunk. I do all those things here. So I don't live in fear of driving, but I'm cautious because I know that if I sped and drove drunk, I could die or kill others, and that's the deal. Similarly, with COVID, I don't live in fear of COVID. I mean, and I have a lot of risks, right? I see kids in the clinic. I have to go to these meetings and do this kind of stuff, so I do have some exposures. I don't live in fear, but I'm very cautious. I wear a mask all the time. I don't think you'll ever see me when I should be wearing a mask when I'm not. I don't go to big parties. Thanksgiving, we're going to do just my wife and I. I don't have lots of other contacts. And so the answer is I don't live in fear either, but I'm aware of the risks, and I take those precautions to reduce the risk. Now, the reason I don't drive drunk, I don't want to get into acts myself, but what would I ever feel if I ran over a little kid in the road? How would I ever feel if I killed a young family because I was driving drunk? And so, I don't do it for a lot of reasons, but the biggest reason is I don't want to hurt others. Similarly, with COVID, I don't want to get it, but I would feel really awful if I brought it to my mom. I would feel really awful if I brought it to a friend and then the friend had a bad outcome. And so a lot of it's like driving. So when someone says, I refuse to live in fear of COVID, that has a political overtone. So I refuse to live in fear. I would say I do too. I don't live in fear of COVID. I'm aware of the problem, and I take reasonable precautions. And you should too. So if you care about me as a friend, if you care about me as a fellow citizen, then please put your darn mask on so that you don't make me sick. I mean, I think however we think about this, I think we can agree that we're not looking to make other people sick. All right, a couple of other things along the way. These increased restrictions are going to go for 2 weeks. They're going to start in earnest next Wednesday. My sense is we got to do this. I mean, the increase in cases that we've seen in Douglas County, the increase in cases that we've seen in Oregon is really not sustainable. I mean, it's going to get to the point where the hospitals really truly will have to close to elective surgeries, where the hospitals will not be safe places to be, and where hospital workers will say, look, I'm just so exhausted from taking care of all these patients, I just can't do it anymore. And then the basic safety net of what we need, which is a good hospital service, will be gone. And so, I know that people will really chafe at these restrictions, but I think we need to do them. Now, one of the most difficult things is what's the right time to do it. So I was listening to the press conference today, and someone says, why did you do this earlier? And the governor says, we're trying to balance all these things. The next question was, why aren't you going to wait another week? And the answer is, well, geez, if both of you are yelling at me that I should do it earlier or do it later, I mean, there's a balance here when to do it. From public health to do this, you could have suggested we never opened up in May, in which case we would likely have still a low number of cases, but the economic problems and the other issues would be enormous. On the other hand, you could say, don't do anything, just go ahead and let it blow through, in which case I think you would be in a situation like they are in other places where hospitals are overcrowded and you have to go to the fairgrounds for people who are sick, or that there's no available ICU beds in Oklahoma. So, if I'm in Oklahoma and I get a heart attack, I'm sorry, there's no ICU beds. That is no way for a society like ours to live. All right. Well, I do have another conference to get to at 5 o'clock tonight, believe it or not. So this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Be safe, be kind, and we're going to do this again next Tuesday.